What do you do if your cat is constantly chewing and scratching itself? Dr. Werber is here to answer just that. I'm Molly, and this is Care Experts. Today we are talking about skin issues with cats with Dr. Jeff Werber, a practicing veterinarian for over 40 years. Dr. Werber, thank you for being here.
Love being here.
So tell us, what are the most common skin issues in cats?
When it comes to cats, I think the most common is what we call miliary dermatitis. The problem with cats, is, let's go backwards to a dog. Depending on where on the body a particular dog problem is, whether it's lower back, whether it's underneath, whether it's face and ears, you kind of have an idea what it is. Cats aren't so nice to us. In other words, if lower back in a dog, you think fleas. Underneath the groin, you think atopy, which is atopic or inhaled allergens. Ears could be overlapping, chewing at the front feet, rubbing the face, you think food allergy. With cat, it's a free range. Anything, any location on the body could be a problem. And they also have certain things called a eosinophilic granuloma complex, which is it's an immune-mediated condition where they will get areas of scabs around the neck and the face, rodent ulcer, linear granuloma. These are all problems that are responsive to steroids. So the good news is that even though you may not be able to know what the source of the allergen is, cats do better than dogs when it comes to treatment.
So some of the common causes of this kind of skin irritation would be like fleas and ticks, and can it be infection?
Actually, it could be infection, fleas. Well, usually at first it's the scratching, and then the scratching breaks the skin. Most of the bacteria that will cause a bacterial skin infection are the normal bacteria that live on the skin, but they peacefully cohabitate. But if that skin gets irritated or inflamed or scratching, that same bacterium now, let's go, moving in for the kill, now we got you. So oftentimes when there's secondary infection, they need to be treated as well as treatment for the allergy.
So signs we're looking for are excessive scratching or maybe
scabs, sores, scratching, areas of hair loss, inflammation. You'll see like sometimes actually lesions in the case of the eosinophilic granuloma complex. So there are anything that's just abnormal, dry, flaky skin, for example. And that could be a sign of there is some imbalance, something that we need to look at, treat, and first diagnose and then treat.
So how do I treat my cat's skin problems?
It all depends on what the source is. Obviously, if we think it's going to be fleas, if you see a lot of fleas or flea dirt, you have to control the fleas. Same thing with ticks. Otherwise, we may not know. Skin scraping will help as far as mites. If ears are involved, we think of ear mites. We think of mange. There's something that we hit, it's called head mange, notoedries. There's scabies, sarcoptes mites. So these are all things that are diagnosed first through skin scrapings, skin biopsy sometimes, and then once we know the exact disease, then we can treat accordingly.
That makes a lot of sense. Now, I know there's a lot on the market of foods that are designed for cats to have healthy skin. Do these work?
The foods that are going to help are, first of all, it's just a good balance of essential fatty acids. When cats have dry skin, obviously there's something lacking in the diet, so we want to rebalance the imbalance. And those are, choosing the right foods. Cats can also have food hypersensitivity. So if a food was recently changed, and since that change, now we're seeing a problem, you got to think, okay, very likely it's that food. Let's go to plan B and choose a different food. If the food has not been changed, and all of a sudden we're seeing a problem, I would then think of allergy, something that may be changing in the cat itself, adding some essential fatty acids. So again, if there's a sudden change, but it's not related to food, I think it's time to see your veterinarian for an exam to really examine the skin and see what's going on.
Okay, excellent. And then the big question, should I bathe my cat?
So yes and no, as you like that for an answer. All right, cats often need bathing. If they are having a skin problem, if they have secondary skin infection, if they have dry, flaky skin, baths could help. Now, is it easy to bathe a cat? Not so easy. Now, some do great, but some just do not like water. And just because they groom themselves, that's not enough of a solution. So you may need the help of a professional, your veterinarian, or a professional groomer that is comfortable with bathing cats. What I recommend, however, is when you get a young cat, you have a kitty, get them start using by doing it in the kitchen sink. Just let water run very lightly on them, and just lather gently. Soap them up. Just don't freak them out. What I recommend also, you've heard of the term scruffing a cat. All right, when you are bathing a cat, as long as you always keep a hand on that scruff, they seem to be more receptive to being bathed. But if you take your hand off that cat, you're now chasing the cat down the hall because that cat's out of there.
The wet cat down
the
the
wet
hall.
cat, sopping wet, right.
So in addition to whether we should bathe them or not, do you have any suggestions on how often we should bathe our cats?
Well, the worst thing you want to do is ask your cat because they'll say never. But depending on the condition, on the length of hair, as I said, the domestic short hairs, the short-haired cats need it less often.
And we will be right back after this brief message from CareCredit.
Thanks to CareCredit, I can take care of my best friend.
Thanks to CareCredit, I can smile again.
Thanks to CareCredit, I can be confident.
Thanks to CareCredit, I can prepare for veterinary care.
I can take care of myself again.
I can be myself again.
I can plan for Cooper's care.
I can take care of my pug family.
I can.
I can.
I can.
I can have peace of mind.
Welcome back. Let's continue our discussion on cat skin issues. What about flea and tick medication? So how often should I be giving my cat that?
It all depends on the medication. The ones that I like the best are the monthly. Some of the topicals work well. There's a new group called the isoxazolines that could be very effective. There are only two that are licensed for cats. One is a topical, and the other one is an oral, both very effective. Avoid, in my opinion, anything over the counter for cats, even if it says safe for cats. Check with your veterinarian. Cats are extremely sensitive to the pyrethrins and the pyrethroids, which are synthetic pyrethrins, and some of them can be deadly. There have been products on the market that have to be pulled off the market. I personally don't trust any of them.
Check with your vet first. That makes a lot of sense. So if my cat is starting to lose hair, why would that be?
Again, is it scratching? So losing hair itself is a sign there's something going on, but it doesn't really clearly tell us what. Is the skin dry and flaky? Do you see fleas or flea dirt on the body? Is there irritation? Is there redness? So these are the things you have to look at and then treat accordingly. Once you have a diagnosis, if you see scabs and scores and intense itching, there's something great for testing cats, and it's called a pinal pedal reflex, okay? And what you do is if you see scabs or sores around the head or neck, what you do is take your finger and just gently tickle the edge of his ear, okay? If that back leg starts going like crazy, that is called the pedal reflex. And that is a sign likely that there is likely a mite infestation.
Well, that's a good trick.
Yeah.
We're all going to be at home tickling our cat's ears.
Tickle your cat's ears.
Okay, so how do I know the difference? Let's say I'm petting my cat and I feel like a lump or a bump. How do I know what it is? Is it a tumor? Is it just a bump? Is it a lump? How do we know?
When you're petting and see a lump, I would recommend all lumps being checked by a veterinarian. It could be a wart. It could be a cyst, benign, both of those. It could be an early type of cancer. If it's here in the neck, it could be a lymph node. So don't ignore any lumps or bumps.
So Dr. Werber, can you tell me what FHS is?
So FHS is feline hyperesthesia syndrome. Hyperesthesia, you've heard of anesthesia. That's no feeling. Hyperesthesia is excessive feeling. So you touch them and all of a sudden they quiver. So when they have, for example, if you have a cat who has flea infestation and you just tickle their back gently, or we talked about the ear tip thing, that in a sense is a hyperesthesia. They are overly sensitive to things that normally wouldn't cause so much sensitivity.
Well, you know what time it is. It's time for myth or fact. All right, Dr. Werber. So myth or fact, cats hate water and we should never bathe them.
Okay, so there's the truth there. Many cats, maybe most, hate water, but absolutely need to be bathed. So it is a myth that they should not be bathed. They should be bathed when there's a problem. Now, cats do groom themselves and oftentimes can take care of themselves, but when there's any kind of skin problem, when to prevent a skin problem, allergies, fleas, etc., is sometimes the treatment of choice, or part of the treatment is going to be some bathing.
All right, fantastic. So next one, myth or fact, cat skin disorders are often signs of underlying internal disease.
There are many diseases that, yes, an imbalance in the body. For example, we talk about dry skin disorders, can be a vitamin deficiency. There are things that may be related. We call it, it's a skin manifestation of an internal or metabolic disease. So yes, it is. It often is. That's true. There are signs. Now, all the time, no. Sometimes, like I said, it could be a flea. It could be an allergy. There are other things that it could be, but there are many times it might be related to some nutritional or metabolic imbalance.
So not quite a myth, but not always a fact.
Correct.
So that brings me to my next one, myth or fact, cats groom themselves so we never have to brush them.
Brushing is very essential. And first of all, many cats like it. I had a cat one. It was a ragdoll, and he saw that brush coming. He would literally on his back, just like that. Okay, brush me, do it. And so they do a great job. Short-haired cats, again, short-haired cats can do much better because they don't usually mat. But medium hair and long hair cats will get matted, and the cats will try to get rid of the mats, and they can't. And then they keep licking and grooming even more. Then they start increasing the skin problem because they're over licking. It's a vicious cycle. So good brushing by us is also an essential part cat health grooming procedure.
So myth, that last one,
Yes.
100% myth.
Yes.
Well, thank you for clearing it up for us, Dr. Werber, and thank you for being here. Thanks for watching. All of our featured care experts recommend and accept the CareCredit credit card, which is accepted at hundreds of thousands of provider locations nationwide. Visit carecredit.com for more information.
Through October 31st, 2023, earn an entry for your chance to win $5,000 in the Let's Get Digital sweepstakes. Enter the secret word hairball in the sweepstakes hub to earn one entry now. Head over to the sweepstakes hub by simply visiting carecredit.com/Let's Get Digital. No purchase necessary. Legal residents of the 50 United States, D.C. and U.S. territories, 18 years of age or older, who have a CareCredit credit card as of 9/12/2023. Void where prohibited. Starts 9/13/2023, ends 10/31/2023. For official rules, including odds, free method of entry, and prize descriptions, visit carecredit.com/Let's Get Digital. Sponsor Synchrony Bank.